birth defects. Birth defects which is associated with the teratogenic drugs. So firstly, to start off with questions, what is the birth defect associated with lithium? Next is, what are the birth defects associated with the valproate? Then the birth defect of the hypoplastic nasal structure. This is associated with which drug? So we'll find out answer to these questions and a lot more on this subject. So looking at teratogenic drugs, we would like to start with the penicillamine. So penicillamine, it results in the cutis laxa syndrome. Next we look at the lithium. So lithium is nothing but it leads to the Epstein anomaly. Next we look at the isotretinoin. So in case of the isotretinoin, it can lead to the facial ear anomaly as well as the heart diseases and the CNS abnormalities. Next is the progesterone. So in case of the progesterone, the side effect being it can lead to the masculinization of the female fetus. So it leads to the masculinization of the female fetus. Next, we look at the quinine. So in case of the quinine, it can lead to the teratogenic effect being the abortion. It can lead to abortion as well as the thrombocytopenia and also the deafness. Next, it can also lead to, in case of the topiramate. So the topiramate, what does it cause? It can lead to the presence of cleft lip. Next we look at the valproate. So in case of valproate, what is done? It can lead to the spina bifida. Then it also leads to the limb defects. It can lead to the aortic spectrum disorder. Next, it can also lead to the facial as well as the cardiac abnormalities, and it can lead to the coarctation of the aorta, can lead to the aortic stenosis, then the pulmonary atresia, next as well as the VSD, that is the ventricular septal defect. Then we look at the next drug, which is nothing but the vitamin D. So in case of vitamin D, the defect being the supravalvular aortic stenosis. Next we look at the warfarin. So in case of warfarin, it can lead to the fetal bleeds. So fetal bleeding. Next, it can also lead to the hypoplastic nasal structure. Next, we move on to the statins. So what does the statins do? The statins can lead to the vertebral as well as the anal, the cardiac, the tracheoesophageal fistula, then the renal, the arterial, and the limb defects. So in short, it is known as the vectoral defects. So vertebral, anal, cardiac, then the tracheoesophageal fistula, the renal as well as the arterial limb defects. Next, we move on to the phenytoin. So in case of phenytoin, what it is, it leads to the VSD. It can lead to ASD as well, ventricular septal defect, atrial septal defect, as well as the coarctation of the aorta. And it can also lead to the patent ductus arteriosus. Next we look at the ACE inhibitors as well as the ARBs. So they are also teratogenic. So it can lead to the hyperplasia of organs. Next, it can also lead to the anuria and the irreversible renal failure. Next, what we look at is the carbimazole and the methimazole. So in case of carbimazole and the methimazole, this leads to the choanal atresia, next the aplasia cutis, then the tracheoesophageal fistula, as well as the fetal goiter. Next, we look at alcohol. So how does the alcohol turn out to be? So in case of alcohol, it can lead to the ASD, that is the atrial septal defect, as well as the VSD, that is the ventricular septal defect. Now, moving on to the answering the questions. So the first question we asked was, in case of the lithium, what is the teratogenic effect? So the lithium, it causes the Epstein anomaly. Next, the question we asked was, in case of valproate, what is caused? So valproate, it can lead to the spina bifida. Next, it can also lead to the limb defects, and it can also lead to the ASD, that is the autism spectrum disorder. Then the facial plus the cardiac anomalies can also be associated. Then moving on, they can also cause the coarctation of the aorta, the aortic stenosis, then the pulmonary atresia, as well as the VSD, that is a ventral septal defect. The next question was the hypoplastic nasal structures. So which drug is associated with this? So it is nothing but the warfarin. So warfarin, it can lead to the fetal bleeding as well as the hypoplastic nasal structures.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.